Hi, everyone. We are so happy for you to join us this morning in this informative and very supportive half hour. The PDX Wellness Coalition is here to support and offer information on helping you sail through this unprecedented time of social distancing, working from home or may not be working at all, with grace, ease, and less stress. Our primary mission is to support your health from nutrition to exercise to alignment to lifestyle and mindset. While all of our businesses are based in the Portland Northwest area, we hope, our, well, all of our businesses are based in the Portland Northwest area. You can all take away tips that can help you wherever you live. So before I introduce Dr. Shamloo, I'd like for each one of the members of the Wellness Coalition to introduce themselves and give a short synopsis of their services and how they are adapting to serving their clients virtually and in person at this time. So I will lead it over to Kirsten to tell us a little bit what you're doing.
Great. Thanks so much, Ethan. Well, I'm Kirsten with the Juice Plus and Power Garden Company, and my background is that I've been a healthcare practitioner for 35 years. I'm an occupational therapist, and a few years ago, I just caught the spark of really helping people support their wellness and prevent the devastating diseases that I was seeing in my healthcare job. So through whole food encapsulated nutrition, which many of you on this call, I think most of you on this call have experienced, it's really Jetson food. It helps bridge the gap with our busy lives when we can't get 7 to 13 fresh servings of fruits and veggies a day. Complete protein powder that's a vegan, non-GMO, NSF certified, amazing source of clean protein, and then Tower Garden. So that's me and what I'm doing. And we had record sales the past 2 months because people are really, really looking for solutions and ways to boost their immune system. So that's me. And I can turn it over to Dr. Krisha.
Hi, I'm Dr. Krisha. I'm a naturopathic physician and licensed acupuncturist here in Northwest Portland. I am actually in a very exciting position right now. So I am doing telemedicine in office, telemedicine as well as in-office visits for local patients. But I'm happy to say that I'm offering the Summer of Health, which is a 3-month really health journey for free for anyone who's listening. It's going to be on Zoom, so I'll list the link in all of that for you. But it's essentially walking through the foundations of health, like nutrition and movement and rest and all those wonderful things that will help to improve your health overall and to build resiliency so that come fall, when we are anticipating that second wave coming, that you're more likely to be less hit or less affected by symptoms, just keeping immune system on point. So super excited about that, and I'll let Ethan go ahead and introduce himself.
All right, yeah, so my name's Ethan Childs, of course. I am a certified personal trainer and certified health and nutrition coach. I found my passion in health and fitness at an early age, and I have this mission of showing as many people as I possibly can on the benefits and the importance of preventative healthcare, like nutrition and good movement. It's so important. So what I've been doing lately in the past is I've been doing a lot of Zoom calls with my clients, and I do remote nutrition and health coaching, as well as remote programming for at-home workouts. It's pretty amazing what you can do with just your body weight, among other things. If you do have any sort of equipment at home, that just adds to it. But with just your body weight, you can accomplish a ton in your at-home movement. And so one thing I just want to kind of surprise, the gym is actually going to open starting June 1st, and so it's going to be a big change. So if anyone has any questions, email me, and I'll give you some more details then. All right, so I'm going to move it over to Dr. Shamloo, and he's going to give us a great talk on alignment and all the great health benefits.
All right. Well, thank you, Ethan. First off, just a little about me. My name is Dr. Shamloo. I am a chiropractor, and I'm actually an upper cervical chiropractor, which is a little bit different. I got my 4-year bachelor's in micromolecular biology, which was fun. And then I did my doctorate at Life Chiropractic College West, and I did my year specialty down there in California as well, where I specialized in the head and neck. So anything from migraines, neck pain, whiplash, vertigo, anything really related to the head or neck. And one thing I wanted to talk about today related to that is something my patients ask me a lot. And because I am a neck specialist, this is something that really ties into what I do in maintaining a lot of the results that I get. And that is a proper pillow. So I'm going to be talking about pillows today. And as we know, if you have a good pillow, you're going to sleep better. And if you sleep better, you're probably going to have less anxiety. It's kind of a chicken or the egg thing. Do you have bad anxiety because you're not sleeping, or do you, not sleep well because you have anxiety? I mean, it's just kind of we don't really know. And it kind of varies with patients, from patient to patient. But what I do know is if you do get good sleep, you're going to function better, you're going to feel better, and your anxiety might, decrease if you are sleeping better. So as we know, there's 3 main positions that we have when we sleep. The first one is back sleeping. The second one is side sleeping. And then the last is stomach sleeping. And most people know this, just like most people know you're not supposed to crack your own neck. But stomach sleeping is actually a terrible way to sleep. And let me tell you why. So when you sleep on your stomach, I mean, everyone can do this right now. If you get your head and you turn it sideways like this, just keep it here. Like my entire presentation, you can just turn your head like this, not even look at me. And eventually what's going to happen is your neck is going to start to hurt. And there's a big reason for that. So the reason is after about 20 minutes, a couple physiological things happen when you keep your head turned in the same position and not move it. Something called creep sets in. And creep is terrible. So what creep is it's basically your ligaments and your muscles getting all sticky and adhesed. And so what happens when you do that, when your head is turned like this, you're actually stretching out one side of your neck and contracting the other side. And what ends up happening, because you're in that position for a long period of time, all the muscles get really sticky. And when you do finally move your neck, maybe when you wake up in the morning, some people sleep wrong, quote unquote, and it's because they were maybe on their stomach, or at some point in the night they did slip into stomach sleeping and they entered that creep phase. And what can happen is you might wake up and you might not be able to turn your neck. Or if you do turn your neck, because you were kind of in that dysfunctional position with your neck for so long, you're going to be more prone to injury with your neck. So things that you normally would do that wouldn't hurt your neck are going to hurt your neck. So, turning your head too fast, bending your head down, just kind of looking a certain way. All these things normally, they don't do anything. But if you're in a bad position when you sleep, it's going to happen, because there's really no position, or there's nothing that you do for like 7 hours besides your mattress sleep that you're going to be using every single day for 7+ hours every day, and that's your pillow. So with that being said, there's one other thing that's really bad about stomach sleeping, and then I'll get off of stomach sleeping because I don't want you guys to do it. And that is when you turn your head for a long period of time, besides causing creep, after 20 minutes, what ends up happening is you have 2 vertebral arteries that innervate your head. And when you turn like this, you actually, after 20 minutes, cut off one side of innervation of blood to your head. And so you're only reliant on one instead of 2. And what happens when you go from 2 sides getting blood to only 1 is your blood pressure is going to go up. So when you're sleeping, and you're sleeping on your stomach for longer than 20 minutes, your blood pressure is going to go up. And that's also not a very good thing to happen when you're sleeping. You're going to wake up, and that's another reason you might feel a little anxious too, is because all of a sudden, you're trying to sleep, you're trying to relax, then your blood pressure is shooting up for, no reason that you know of. So let's talk about good ways to sleep. and that is side sleeping and back sleeping. Now, there is some things that we have to talk about when it comes to those. We have to have a good pillow. You could be sleeping on your side or back and get terrible night's sleep and terrible support because you don't have a pillow that fits you properly. So at my office, I obviously can measure someone for a pillow, and that's what I do. But you know, if you live somewhere else or you're not my patient, you obviously can't. So what are some things that you can do to find a good pillow for you? The key is neutrality. And what I mean by neutrality is if you're standing up straight and looking in the mirror, that's how you should be positioned when you're sleeping. It shouldn't be like this. It shouldn't be like this. It shouldn't be like this or this. It needs to be neutral. So if you get a pillow and you're neutral, that's great. Now, a lot of places you can't try the pillow when you're, you know, before you buy it, but, or measure it. But, you know, if you have like if you get it at Costco or something, there's like a really good return policy. You can maybe try it, maybe have a spouse or a friend look at you when you're sleeping and just see how your head is looking when you're sleeping, and hopefully it fits properly and you're in that neutral position. If you are, it's going to be a lot more supportive for you. So yeah, keys with that, you just want to make sure if you're on your side, it's not too fluffy of a pillow, so your head's not tilting this way, or not supportive enough where your head's going down. And then if you're on your back sleeping, you want to make sure the pillow's not too fluffy where your head's going forward when you sleep, or if it's not, I guess it's not supportive enough, your head's going to just be going back like that. And none of those positions are good. You want that neutral position. The pillow that I make all my family members use and that I recommend for my patients is this pillow. And the reason that I do, well, there's a lot of reasons I recommend it. It's a Therapeutica pillow. It's an amazing pillow if you measure correctly for it. It's a horrible pillow if you just go buy it and you don't know your size. I have a patient that actually bought it and they had the wrong size, and then they stopped using it because it wasn't they thought it didn't work. But then I measured them for them and they got the right size, and they're like, this is the best pillow I've ever had in my life. And so it does make a difference if you are measured for this pillow. It's a side and back sleeping pillow, so it's a hybrid pillow. So it's going to promote those two ways of sleeping, which is amazing. It makes it almost impossible to sleep on your stomach. If you do, you're like an acrobat or something, because it's almost impossible to actually get into a comfortable position on your stomach with this pillow. So yeah, this is what I recommend for my patients. It's a really good pillow. If you are near someone that could measure you for it, that's great. But it's just one of the pillows that I really recommend, because it's going to not only support your neck, but also your upper back too, which is one of the missing links with proper pillow stability. But yeah, other than that, I'll just kind of finish by saying pillows are very important, and they're a way cheaper option than a new mattress. So if you have kind of an older mattress that's not really doing the job, if you can get a good pillow, it's a nice supplementary thing until you can maybe get a new mattress. And it's way more affordable, and your neck and back will thank you for it, because having that proper support for that 7-hour period you're sleeping is going to make a huge difference in your sleep quality and how good you feel and your function, and of course your anxiety levels. If you're getting that proper sleep, those are gonna go down. So yeah, I'll kind of open it up to questions if anyone has a couple questions.
Yeah, Dr. Shamloo, there's a question in the chat box here. Is there any way that we can measure ourselves for a pillow and then order through you?
Well, I can in the chat box put the measurement, what the measurements are for every single size, and that way people can kind of get their own measuring tape and measure certain spots. So basically, where you want to measure is this part, just kind of where your neck connects to your shoulder, all the way till, well, the scientific name, the acromion process, but it's right here. It's the first bony little thing that you feel where your shoulder is. right there. And that's where you want to measure this area right here. And that won't really matter if your head's like this or like this, because that doesn't really change. But you want to just measure that area. So it's that first in the front, that first bony spot that you feel when you move away from this spot right here between your neck and your shoulder. So it's just going to be right there. I'm trying to talk in layman's terms. So yeah, just right there. You want to measure that. And then I'll put the measurements for the different sizes so people can see what those are.
That's great. And yeah, and if you could put your email address or however you would want people to contact you too. I think I'm definitely overdue. And I'm one of those that I won't buy an expensive pillow because I'm afraid that it won't work. And so I'm buying cheap ass pillows from Target for like $4 that are good for a week and then they're not. And I'm just horrible. And I'm one of your patients, and it would help me so much to have a good pillow.
Yeah, it's kind of one of those things. It's like you wouldn't really buy shoes that don't fit, right? So why do we
Unless they were really cute, then you would.
Yeah, well, yeah, exactly.
You just feel for a day.
But
I have a question.
Yeah.
So I know stomach sleeping is not great, but if you have a consistent stomach sleeper, is there a good pillow for that can help in some way?
The only way that it's good, if you can, the only way sleeping on your stomach works is, I don't know if you've seen like a massage chair, but if you're laying on your stomach on a massage chair, for example, and there's a hole where your head can go down, that's the only way really, because that's going to keep that neutral position. Any other way you sleep on your stomach in a traditional bed, you're going to be turning your head. And turning your head and laying it down with gravity pushing down on your head is going to really tweak all the stuff I was talking about, your vertebral arteries, the structures in your neck. So there really is no good way to sleep on your stomach unless you can be in that neutral position. Yeah, that's pretty much it. So if you have like a really awesome bed that you could do that in, number one, I would have to get that.
Airplane pillow. Put space in.
An airplane pillow?
Yeah.
Oh, like so it has your head right there? Here's the problem. If you had an airplane pillow, your head is going to be backed up because it's going to be pushing your head back up. And so you're going to be in that extension position. So
he needs to go to the side.
Yeah, the best thing to do would probably be to buy a massage table and just use that as a bed, because if you had to sleep on your stomach, because that's really the only way that you can, number one, breathe, if your head's just right down on the pillow, and then number two, not get extra tension other places in your neck, unfortunately.
Fair enough, thanks.
And if you're lucky, try to get a massage table that comes with a massage therapist.
Yeah.
I'll put you right out.
That would be good. That's an expensive proposition, though. It's a lot cheaper just to get a pillow that, promotes side or back sleeping. That's going to be optimal. Any other questions?
I have a comment. Actually used to be a stomach sleeper, and I got that pillow, and I basically made myself, it sounds kind of weird, but it's like after sleeping on my side and back, just continuously, even at first it was kind of uncomfortable, I sleep way better now. And it's, it's something that can be, adjusted and changed.
Yeah. I always say it takes about 2 weeks, whether you get a new mattress or you get a new pillow, it takes about 2 weeks to break it in. So if you can push through for about 2 weeks, and it's not, obviously that's like the longest. It's usually, shorter than that. But if you can last 2 weeks consistently with that habit, you'll get used to it. And the same goes for cracking your neck, cracking your back. If you can last 2 weeks without doing it, you can change that habit pretty easily.
I was just trying to crack my back as you said that. It was like you could see me.
Brittany, I'm calling you out right now.
I know. I was just stretching. I was like, oh, and you're like, if you get, oh, damn it.
That's funny.
Well,
All
this
right.
was such great information, Dr. Shamloo. And even though I've heard some of it in bits and pieces, it's just such a reminder to me. And especially
Yes.
like Dr. Olson said, so many of us are spending so much more time at the computer right now that I'm really noticing such a difference. One, since I can't get in to see you as often, and two, just with all that sitting. So thank you so much.
Yeah, and I'm gonna put in the chat right now the sizes. So if you are kind of out there, you can kind of measure yourself with a ruler or like some measuring tape, and you can kind of know where you're at as far as what that measurement is. So I'll do that right now.
I got a question for Ethan, actually. How long did it take you to get comfortable from stomach sleeping to side or back?
So I've been a stomach sleeper for a while, and I've had like neck issues because of that, to be honest. And so at first it was harder because it's raised. So you actually don't even want to sleep on your stomach, like when you get it, because on a regular pillow they're so like plush, and they like flatten out so much. You can actually like get comfortable because the pillow flattens out. But then on this, because it's so raised, when you're like on your stomach, it's like impossible to go to sleep. It's like it's like sleeping on like a hill. But but so for me, it took me about a week, probably like 7 days. Yeah.
Yeah, I think it took me a little bit of time to get comfortable to that pillow just because it's so different. But now it actually will, like, I can tell when I'm out of alignment. And when I get back in, and so I'll go to sleep out of alignment and I'll wake up back in alignment because I was actually sleeping in the position that my neck needed to be in.
Yeah.
Yeah.
Yeah, muscle memory will pull it back sometimes. If you have a good pillow, it will sometimes pull it back into alignment.
And like sleeping on your back on the pillow, like I'm a side sleeper most of the time, but sleeping on your back, like if you get that like middle spot, because the pillow has like an indent in the center, that puts me right out, to be honest.
Mm-hmm. Yeah, I mean, people find what if you're a side sleeper, your body's gonna like to be on the side. If you're a back sleeper, it's gonna really prefer and it will let you know. I mean, your body's pretty smart. It lets you know what it wants to be in. So makes sense.
Are there any other questions for Dr. Shamloo? I'm screenshotting your measurements here, Dr. Shamloo. If there's no other questions, I'm going to take it off record, but I'm going to ask this crew to stay on because we have a name contest challenge for you. So I want to just thank you so much for your expertise and let everyone know that we are going to continue. Next week will be Ethan. And the challenge I'm going to put out to you off recording has to do with our name for June. So tune in, stay tuned. We're all going to be continuing this series.